Hello, my name is Mohammed Ali Alvi. I'm a senior research fellow in the Mayo Clinic Neuroinformatics Lab, the Department of Neurosurgery at Mayo Clinic. And today I'll be discussing with you some of the results from my thesis work, which looked at outpatient spine surgery outcomes, particularly asking the question, are all outpatient spine surgeries the same? Evaluating the differences in early outcomes of patients undergoing lumbar decompression and hospital outpatient versus freestanding ambulatory surgical centers. I do want to disclose that this publication was made possible by a CTSA grant that was provided by National Center for Advancing Translational Sciences, a component of NIH to the Mayo Graduate School. I also want to disclose that Shyam Kurin, who's one of the co-authors in this project, was also awarded the Department of Neurosurgery Union Professorship Research Grant for this project. So as most of you may know, outpatient surgery has increased significantly in the past 3 decades. Outpatient cervical procedures have increased by 60.5% between 1994 and 2006, while lumbar spine procedures in the outpatient setting have increased from 18.7% in 2003 to 68.5% in 2014, according to a study. As most of you may know, there is currently an exhaustive amount of literature on outpatient spine surgery. All of these publications and studies have answered the question that outpatient surgery may be performed safely for spinal surgeries and that is associated with optimum outcomes. However, what these studies lack is a distinction between where the outpatient surgery is performed. Is it performed in the hospital outpatient setting or freestanding ambulatory surgical centers or ASCs? Therefore, our objective in this study was to compare the rate and reasons for 7-day readmissions and reoperations among patients undergoing outpatient lumbar decompression. Why we looked at 7-day readmissions and reoperations? According to this report by the Yale New Haven Health Services Corporation Center for Outcomes Research and Evaluation for CMS, most readmissions after surgery occur in the first 7 days that are related to the index surgery. Therefore, for outpatient surgeries, 7-day readmission is now being used as a standard metric to compare outcomes and benchmark outcomes between centers. So going over methods, we chose the State Ambulatory Surgery Database, or SASD, which is offered by the Healthcare Cost and Utilization Project. We linked the SASD to State Inpatient Database and State Emergency Department Database. We chose the state of Florida for this project and the years 2013 and 2014. We grouped patients into those undergoing the procedure in an ASC and those in a hospital outpatient. Going over results, we found a total of 25,486 patients, of which 7,067 patients underwent the procedure in an ASC, while 18,419 patients underwent the procedure in a hospital outpatient. These are the baseline demographic characteristics, and as you can see, patients in the ASC setting were more likely to be younger compared to those in the hospital outpatient. Looking at clinical and comorbidities, we found that patients in the hospital outpatient setting were significantly more likely to have higher number of comorbidities. Moreover, patients in the hospital outpatient were slightly more likely to undergo more complex procedure as indicated by number of levels. So going over the main results, we found that patients in the ASC setting were more likely to have a higher 7-day readmission rate. In particular, they had a readmission rate of 7.4% compared to 0.9% in the hospital outpatient setting. We also looked at where these patients underwent a readmission. And as you can see, most patients in the ASC setting were likely to be readmitted to another outpatient center. 0.2% of these went to an inpatient setting and 0.1% to an emergency department. In contrast, patients in the hospital outpatient setting were more likely to be readmitted to an inpatient setting, 0.6%, followed by emergency department, 0.2%, and then finally in another outpatient setting, 0.1%. We also looked at reasons for readmission, and we found that in both groups, majority of patients were likely to be readmitted due to recurrence of symptoms. This was marked when the diagnosis code at readmission was the same as the index, was same or similar to the index admission. We also looked at reoperations, and again, patients in the ASC had a reoperation rate within 7 days of 7.1% compared to 0.4% in the hospital outpatient setting. We also looked at what procedure they underwent. So as you can see, most patients who underwent the index procedure in an ASC were likely to get a repeat decompression. 0.4% were also likely also got a lumbar fusion, while 0.1% got a wound-related procedure such as incision and drainage for surgical site infection. In the hospital outpatient setting, most patients underwent a repeat decompression, while some also underwent a wound-related procedure. None of the patients in the hospital outpatient required a fusion within the first 7 days. Upon multivariable analysis, we found that patients in the ASC setting were 8 times more likely to have a 7-day readmission after adjusting for age, sex, insurance status, number of comorbidities, and number of operative levels. Moreover, we also found that patients in the ASC setting were 18 times more likely to get a reoperation within the first 7 days. So what do these results mean? We looked at the current literature comparing 7-day outcomes, and there were very few studies. We found one study from Taiwan that looked at 7-day outcomes after spinal surgery. Of the 10,350 cases that the authors reported, 5,366 were lumbar decompression. Of these, 0.7% of cases required a reoperation due to inadequate recompression. This rate was interestingly similar to the one that we found for our hospital outpatient group. Our analysis, though restricted to a single state, make the distinction that the value of outpatient surgery may be restricted to hospital-affiliated outpatient departments, while freestanding ASCs may not be as safe as have historically been touted to be. This is evident by the significantly high risk of early readmissions within 7 days, as well as 30-day and 90-day readmissions, which are not displayed here but were analyzed for my thesis project, and also high complication rate and high reoperation rate among patients in the ASC. Our results warrant close investigation into outcomes of high-risk surgical procedures and question the safety of these procedures being performed in such freestanding ASCs. I would like to acknowledge my mentor, Dr. Biden, my thesis advisory committee, including Dr. Jeffrey, Dr. Nasons, and Dr. Spinner. My contact information is displayed on this slide. And of course, I would also like to acknowledge the Mayo Graduate School, Department of Neurosurgery, and the Neuroinformatics Lab.